There's some quite alarming statistics that have come out from the government today suggesting a million Australians have needed help for mental health issues since the COVID outbreak, but also there's been quite an uptick in Victoria, so there's been a 30% increase just over the past 4 weeks alone. Is that being mirrored in your own electorate?
Yeah, I'm not surprised by these statistics at all. I think the mental health strain on Victorians in my electorate has been immense. We're in Mental Health Month, actually, and 1 in 5 Australians have experienced mental illness even before COVID-19. So the restrictions and the pandemic and everything that's happened to all of us this year, particularly in Victoria, has only exacerbated those strains. And, you see it with parents, with small business owners, you see it with students and young people, you see it with singles, people who live alone, and even the elderly, who are more isolated. We've had to do grocery drop-offs and things like that. Just call them up on the phone just to have a chat, just to keep connected with people. And look, the good news is that school's back, so that's a big relief for parents, frankly. And there is a real strain on people's mental health during these restrictions.
Yeah. So what does that say to you? You've got to get people back outside, back outdoors, and try and get things back to the way they were.
Absolutely, Pete. And look, your lead story there about the restrictions in Victoria, setting aside all the politics. And this is not about politics now. It's about good public policy. I think the Victorian government, obviously, they're responsible for the hotel quarantine. I've raised issues as constructively as I can about the fact that there hasn't been capacity or good enough capacity on contact tracing, raised issues around the restrictions and the inconsistency around some of those restrictions. So it's not a partisan thing. It's about good public policy, and they are trying, obviously, to bring down this second wave so that we don't have the health system overwhelmed. But you've got to make, obviously, decisions about the cost to people's health, mental health, as well as other health issues. Cancer screening has dropped because people have been scared to go and get tested. Things like that need to be assessed in all of this. And I would say, frankly, once we get contact tracing up to a capacity that is really, really good, you really want to be able to localise your response to outbreaks, like the ones we've seen in Shepparton and in parts of country Victoria. You localise that response. You don't lock down the entire state because of a breakout in Shepparton, for example.
The Premier is now suggesting, and Daniel Andrews is now suggesting, that the current numbers are as good as it gets. So he's not going to be able to get to, his level of 5 and then 0 before easing restrictions. So is that another example of the goal of elimination being impossible?
Well, the state governments have said that they're not trying to get to elimination.
Well, Jenny Mikakos would disagree.
Yeah, well, it's a good point. It was a very strict form of suppression, which it's all a bit semantics, isn't it?
Yes, right? strict suppression or elimination, that's the same thing.
Yeah, technically, but if you look at New Zealand, for example, you can't. They had outbreaks even after they supposedly had eliminated the virus from the country. So I think we're stuck with this virus. Everyone knows that. That's why the response has to be, there has to be an alacrity of response. It has to be quick fire. It has to be localised. The contact tracing has to be really on top of its game and very strict, if you like, at a local level. So you don't collectively sort of, shut down the rest of the state or the city or the economies there and trying to get back to what the Premier's called COVID normal. And now they're working through all those figures. I'm not privy to all the figures, and I'm not a medical expert. But politicians, leaders have to make tough decisions. How much risk are we prepared to take vis-a-vis the mortality rate with the virus and the capacity of the health system and the ICU capacity? Now, right now in Victoria, we've got, I think, 23 people in hospital with COVID-19. The ICU capacity is, I think there's a couple of people on ICU, but we have about 800, 900 beds. How much are you prepared to take of that? Now, you look at the UK, Boris Johnson's had to go back to a sort of partial lockdown or three-stage lockdown because the health system is now being overwhelmed, or the ICUs are being overwhelmed. So it's about getting that balance right.
Donald Trump's going the other way.
That's right. And there's been a lot of criticism of that. And I think political leaders around the world have struggled. You've got one end of the spectrum, Donald Trump was like, let it rip, it doesn't really matter. And the other end of the spectrum, obviously, a much stricter, a much more concern around having any of the virus, get out of hand, as it were. It's somewhere in the middle is COVID normal until we get a vaccine, if we ever get a vaccine, and we have to actually face that reality.
Okay, just finally, Peter, and we've got our eyes on Josh Frydenberg at the moment. He's about to attend a doorstop. So we'll cross. Well, there's the live pictures now. So when we start hearing from Josh, we'll bring that to you live, folks. But just finally, you brought up the economy. I'd like to ask you about that, Pete, because there's a report in the Financial Review this morning that suggests that Anthony Albanese is likely to scale back stage 3 tax cuts if he wins office, rather than revoke them. What would you like to see on that front?
Well, last year I argued very, very strongly that we should support the tax cuts for stage 1 and stage 2. I didn't agree with the stage 3, never have, and Labor, the caucus, has never agreed with the stage 3 because of $80 billion that would go to high income earners, people earning over $200,000, mate.
But that doesn't change. For people earning over 200K, there's no change there. They're at 45%.
Well, we're looking at amending elements of the package so that the stage 3 tax cuts don't go all, the $80 billion doesn't go all to tax cuts. It can be spent on schools, on roads, on hospitals, on manufacturing, on job creation. And people who are low and middle income earners, they spend their tax cuts. The evidence is there. The economic evidence is there. They'll spend it in the economy. And that's a good thing. That's why we supported stage 1 and stage 2. So I think we've settled on a very good position. And I think the government is being a bit stubborn about this, frankly, because they know that those stage 3 tax cuts, that $80 billion, can be spent better elsewhere.
So would it be your plan to scale back or revoke? Just to be clear, you'd revoke that completely.
Well, I don't know. We'd have to look at
if you want
the stage 3. The caucus will have to look at the stage 3 tax cuts at the time, look at the economy at the time, and assess what kind of scaling back or
because there's a lot of people in that bracket. There's a lot of people in that bracket.
Over 200 grand.
Under the one under.
Yeah, but if you're amending something, you want to make sure that the stage 1 and stage 2 tax cuts, and I think you're talking about stage 3 impacting people who are low and middle income earners. Of course, we're going to look at that because what we want is to make sure that the people low and middle income earners are getting all of their tax cuts, even if some of it flows from stage 3. Now, technically, how we do that with amendments to a bill, if we win government, it's all hypothetical, right? But if we win government, that'll be the work that we would have to do.
Well,
the principle, Peter, the principle is making sure that the money flows to low and middle income earners under 200,000, if you like, but the high income earners are not getting 80 billion in tax cuts or thereabouts, that money is spent on education, on schools, on hospitals, and so on.